Hi, my name is Randy Rouge. I'd like to spend a few minutes talking to you about some of the non-medical things we do at SewHope. When I first started coming to Guatemala on medical mission trips with my wife Ann about 20 years ago, I was dumbfounded by the horrible poverty and terrible living conditions of many people here. In 2006, when we started SewHope, we knew we had to do more of the medical care to address people's health in a holistic way. So I'm going to describe a few of those ways, those projects, if you will, that we put under the umbrella of public health. As you can see in the background, we have about 4.5 acres here that we grow many things, fruits and vegetables, things like melons and peppers, cucumbers, papaya and squash. And those foods are used added to the kids' meals for their lunches to provide them some additional nutrition. The vegetables and fruits we sell in the market. And also, though, the kids and the parents help grow those vegetables, so they learn how to grow the vegetables themselves. Okay, and many of the families now have home gardens in their backyards. So that's been a real success. One of the newer innovations that we put in was a drip irrigation system that really helps save water and save a lot of labor for Elder and Marcelo, the two men that work on the agricultural products. No longer do they have to carry water to the plants, but they also they now can just let the water just drip and irrigate the plants automatically. It's really great. Another thing that we grow here are fish. So we have 3 tilapia tanks here, and those fish are grown from very small fish. We start with about 1,000 small tiny fish, and Elder and Marcelo raise those fish up to about the size of a pound, and those fish then are sold in the market. They're also added to the kids' meals for nutrition. And again, the families and the children learn how to do these things so they can go back one day and do it on their own. We also grow a lot of chickens here. Past year, we raised about 200 chickens. Those chickens, again, are raised by the children and the families, and then those chickens provide food for the children and the families, the eggs and the meat. We also sell those chickens in the market again, and we get a nice price for those. So again, that's another thing that we do here as part of our broader view of public health. We also do things in the homes to try to help them improve the homes. So we have some clean burning stoves called chispa stoves, and those use very little wood. They're very efficient in their use. They're safe. The children aren't in danger of getting burned. There's no indoor air pollution. There's a lot less wood consumption that costs the families less money, creates less air pollution. It saves the forest from being deforested. And those have been a tremendous innovation and useful for the families as well. So we also have some new innovations, solar lights. Many of the families don't have electricity, so they don't have lights, and they have to use kerosene burners or candles, and that costs money, and they're dirty, and also they're very dangerous. Those things tip over, sometimes start fires. We've seen many children with burns, terrible scars from burns. But providing them with a solar rechargeable lamp, they can do work at night. The children can study. They can have some family activities in the evenings when it gets very dark. And it gets very dark early here in Guatemala. Another way that we help the families is with clean water. Many of the families don't have good sources of clean water. They get their water from groundwater sources, which is very dirty and obviously very unhealthy. So we do this in 2 ways. We provide them with filters called eco filters, which are sufficient for a single family. We also have larger units that we provide to communities. These are filters that can serve over 300 families. And so those are just a few of the innovations that we've brought into our public health programs over the years. And so, like medical care, those things can greatly improve the health of the whole person and the families. Thank you for watching my video and supporting SewHope.